to have the surgery. And I think that his autonomy was definitely compromised in the decision. The daughter threatened to sue the hospital if her wishes were not granted, and that was just to go ahead and provide surgery for her father. And I think that was kind of a selfish decision on her behalf, and very neglectful decision on the doctor's behalf. Sometimes, as caregivers, we think that we're making the best decision for our loved ones or for our parents, and we don't take into consideration their decisions or um, how they want to be treated or the services they want to have provided, and we make those decisions for them, even if they are capable of making those decisions for themselves. In this case, I do believe that the doctor definitely practiced some unlawful and unethical decision making. Number one, I think that he should have removed the patient from the environment and perhaps did another evaluation within a 24 to 48-hour period. As Nurse Hattie stated in her statement as well, that sometimes being in that type of environment of the ER, and also because he did suffer from respiratory distress, kind of put him at a confused state, and perhaps removing him from that environment may have made the decision or just the outcome a little bit different for him. He would have been in a different mental state. So again, I feel that Dr. Jason kind of jumped the gun and didn't consult with any further medical team. I don't think that he really considered the results from the social worker as well, and making the decision for Mr. Menendez, and kind of obliging the daughter's decision to go ahead and amputate that leg. I do believe that the daughter was very neglectful as well. Perhaps she was also concerned about potential of neglect being found on her behalf, and that's why she wanted to make such a rash decision, and even was threatening to sue the hospital if her demands were not met. But again, being a medical professional, being an educated individual, the doctor should have definitely went another way. He didn't even consult with her. He doesn't know if she has power of attorney over her father. Just because you are the child of a parent doesn't necessarily mean that you are in the position to make such medical decisions regarding that your loved one's health. So I think he definitely just kind of dropped the bar there as well. As a health administrator, of course, those raise red flags. Just with the decision that he made, being neglectful, to me, not executing just executing the situation in a professional way, using his credentials and education and his resources as well. I think that he was very neglectful. I think that he was concerned about the patient's threats, um, and just kind of went along with her decision to go ahead and amputate without thinking about the patient's autonomy and his capability. Was he competent enough to say, hey, yes, I've lived a great life, as he stated?